When I was pregnant during the pandemic, I definitely felt a heightened sense of anxiety. This was my first pregnancy, so there's already a lot of unknowns and a lot of stuff happening.
Getting vaccinated while pregnant was very confusing. As you may know, when you're pregnant, you're even scared to do things like eating unpasteurized cheese, let alone getting a vaccine that hasn't been heavily tested.
I wanted to try to do everything possible to make sure that my baby would be safe, but COVID was the one factor where it was hard to feel like you had control over doing that.
I was actively seeking out trying to get the vaccine, but kept facing roadblocks. It was a time of a lot of worry because I also was thinking about how getting the vaccine would help Ruby be safe as well once she was born.
Before a vaccine for children were available, the best way for families to stay safe throughout the pandemic was for parents to get vaccinated first. But for those expecting, it was a little less straightforward.
A gap in research meant that there was a delay in prioritizing vaccines for this demographic. How did this happen? And what do we know about pregnancy risks and the vaccines today? I'm Rumila.
And I'm Fabio, and we're asking you to join us as we look into vaccine hesitancy in pregnant and lactating people in Canada.
Hi, Louis. It's so good to see you.
Good to see you too. This is Ruby.
Hi, Ruby. Thank you so much for coming all this way.
Oh, our pleasure. Yes.
I know that you had a hard time getting the COVID-19 vaccine. I'm wondering, how are you doing now? And can you tell me a little bit about your experiences?
Absolutely. I'm relieved now that I have been double vaccinated. When I was mid-pregnancy, I was faced with many challenges. Living out in rural Mission, I was reading stories about women locally who were pregnant and faced many complications due to COVID. In fact, one woman ended up in the ICU after giving birth. I was really actively seeking out the vaccine. I was told that maybe I was suffering from anxiety. I was told that I just needed to wait, which is tough to do when you have a deadline of a baby being born.
How did that make you feel?
Yeah, I felt really frustrated at the time and alone. I thought that, as a pregnant woman, there would be more support and more help, and how could this whole community of women be forgotten, essentially?
Why was it important for you to get the vaccine?
Yeah, it was very important for me because I'm a high school teacher, so hundreds of students every day and colleagues as well that we would interact with closely. That was a definite risk, and I didn't want to jeopardize my family or my situation as a pregnant woman.
I'm so sorry to hear about your experience, and you're not alone. What you're experiencing has been called the pregnancy paradox. Because pregnant people and those who are lactating were not included in COVID-19 vaccine trials, it created this gap in research and eventually caused what you're experiencing in the medical healthcare system. How did you end up getting the vaccine after these roadblocks?
Yeah, so eventually I was prioritized, but not because I was a pregnant woman, because I was a teacher and an essential worker.
Yeah, Fabio's actually going to speak to Dr. Manish Sadarangani. He works at BC Children's Hospital, and I'd love to relay some of the conversation we've had over to him so we can learn a little bit more about why this was happening. Would you be okay with that?
Absolutely. Yeah.
Would you be okay with that?
It's your story too.
When you're pregnant, you really want the professionals to give you clear, concise, and validate that information for you and help reassure you in your decision making. When I felt like the professionals were kind of wishy-washy about it, it made me even more nervous.
So I wasn't sure if I should be taking the risk to get vaccinated even though pregnant women were not part of the trial, or if I should take the risk of being exposed to the virus without having any antibodies.
I actually was quite frustrated that I wasn't put in the prioritized group earlier, despite all of the research saying that pregnant women and their babies are more at risk.
Hi, Dr. Sadarangani. Thank you for joining us today. Can you talk a little bit more about the exclusion of pregnant and lactating people from vaccine trials?
Hi, Fabia. So unfortunately, what we've seen with COVID-19 is something that's happened over and over again. I think the Ebola epidemic in West Africa is a great example. A lot of pregnant and lactating people were very severely affected by the pandemic and really should have been at the top of the list for vaccination. Unfortunately, because the trials were not done in pregnant people from the beginning, it means when vaccines were rolled out, they were excluded from that vaccine rollout. And it meant that actually people who are really important in transmission of Ebola and really important in protecting the community were not able to get vaccinated because we didn't have the research data needed to be completely confident that the vaccine was going to be safe and effective in pregnant and lactating people.
And I've heard that's called the pregnancy paradox. Can you talk a little bit more about that?
Not only is this a group that we want to prevent disease in, but the paradox is that this is a group at higher risk. And so we know for COVID-19 that pregnant people are at significantly higher risk of severe disease than non-pregnant people. And so this is really a group that not only should we not be delaying including them in trials, we should be prioritizing including them in trials. And we should be getting data in this group as quickly as possible so that when we want to roll out vaccine programs, we can prioritize these alongside other groups that we know are at high risk.
What would be the benefits of a person who's pregnant or lactating getting the COVID-19 vaccine?
Yeah, so that's a really good question. I think by vaccinating pregnant people, you essentially get a 2-for-1. So you get to protect the pregnant person themselves and prevent them getting the disease and getting very sick from the disease, but also the antibodies, which is the immune response to the vaccine, that is the protective part of the immune response, is actually passed through the placenta into the fetus and then stays with that infant for the first few months of their life. So it also will protect them against the disease for the first few months of their life. And that's really, really important because for most diseases, including COVID, we don't have vaccines for these very young babies. And so the only way to really effectively prevent disease in very young infants is by vaccinating the pregnant mother.
That's fascinating. And would that happen also through breastfeeding?
Yeah, so there'll be some transfer of antibodies as well through the breastfeeding. And I think breastfeeding also has a number of other effects to protect against infection, particularly against gastrointestinal infections, so diarrhea, vomiting kind of bugs, and respiratory infections such as COVID-19.
Amazing. What do you recommend for future research?
So I think ultimately, it's really important that we close this gap and we don't leave pregnant and lactating people behind when we're designing vaccines and doing vaccine trials. So I think it really boils down to getting pregnant and lactating people into trials much, much earlier so that they're able to have equal access both to the research but also to the vaccines when they're available.
Amazing, thank you.
Okay, so we're going to try and illustrate how the pregnancy paradox affected pregnant and lactating people in Canada. So the first recorded COVID-19 case in Canada was in January of 2020. It took almost 14 months, so that's December of 2020 to January of 2021, for vaccines to start rolling out for the average citizen. It took almost 18 months, an additional 4 months, for pregnant and lactating individuals to get prioritized for the COVID-19 vaccine.
Okay, so this is the delay I was experiencing.
Right, the pregnancy paradox. And there are still other groups like those who are immunosuppressed and those with allergies who still haven't gotten prioritized for the COVID-19 vaccine. The good news is that Dr. Sadarangani believes that we can close this gap, and it's by including these groups in clinical trials for vaccine development in the future. And there's also an additional way to keep our families safe, which is by getting our kids vaccinated.
For the most part, parents have their child's best interests at heart, and so they do everything they can to make sure their child receives proper health care when they're unwell. And so when we see them in the ICU, we can normally be very reassuring to parents that they've done everything appropriately. We go back through the whole story, and there's really nothing that we can say to them that could have been done differently to stop your child from becoming so sick, and it's just one of those things. Sadly, there's some cases where children are not vaccinated. We can say that if this child had been vaccinated, it may have prevented this illness, and it's a real tragedy, I think, because these are potentially preventable events.
I feel really happy that I made the decision to get vaccinated. Science is amazing.
1.5 months after I gave birth, my entire family got COVID-19. I am grateful that I was able to get vaccinated and that when we were exposed to the virus, the case was not very severe.
Once I had the vaccine and it had been a couple weeks and I knew I had some immunity, I felt a lot more relieved and just I felt like I could go about my regular workday and my regular life without feeling that little bit of unease in the back of my mind.
Speaking to Lois and Dr. Sadarangani today actually helped answer a lot of questions as to why pregnant and lactating people face so many barriers when trying to access a vaccine.
Yeah, and it's so hopeful to learn that we can avoid this gap in future pandemics by considering these populations in all stages of vaccine development.
And that's a more equitable future that these kids we met today are going to help us build.
I, of course, want the world to be better for her and for the next generation and the generations beyond that. How could you not be hopeful with her?